Hello, welcome to the Untitled Show. I'm Dr. Yannick Pauly from UntitledSolution.com, and in this episode we're answering the question, what causes ADHD? Well, obviously we only have 3 minutes and it's going to be difficult to answer that question in detail, so I'll just give you an overview of it, and in the future I will be producing a special series on the causes of ADHD. If you ask that question to a medical doctor, they will tell you that we don't really know what's causing ADHD, and it's mainly an imbalance in neurotransmitter in the brain, so we need to give a drug to treat the symptoms. Now, this is a very reductionistic view of reality. There's a lot of things that will, if not cause, at least participate to ADHD. As well, we've talked about in previous videos that ADHD is a spectrum disorder, meaning, a million children with the same diagnosis, they all have different problems. So what may be causing that symptoms in a child may be totally different in another one. In the Untitled Solution, we have a very specific way of thinking about what causes ADHD, and there's two big categories. The first one is what we call antecedents, and antecedents are essentially risk factors, things that will happen during conception, meaning when the woman is pregnant, and that will kind of prepare or create a predisposition for the child to develop ADHD. And in those antecedents, there's two types. The first one is genetic, so there's definitely a genetic predisposition to it. But before jumping to conclusion and thinking nothing can be done, remember, genetic is the loaded gun. You need the environment to press the trigger. So we said antecedents, they can be genetic or acquired. And in the acquired ones, well, we know that toxins are a risk factor. If the mother drinks alcohol or smokes cigarettes during pregnancy, that's a risk factor. If the fetus or the baby is exposed to toxins, again through smoking or alcohol, or through heavy metals such as mercury that we can find in amalgams in women's teeth, or through vaccinations, these are risk factors. Other risk factors are deficiencies, for example in essential fatty acids like omega-3 or omega-6, as well as deficiencies in minerals, vitamins, and so forth and so on. So this is the antecedents. They will predispose the child to developing ADHD. Now after that we have the second category, which we call triggers, and those triggers, they are things, imbalances in the environment or in the body that will come on top of the predisposition to really trigger the symptoms of ADHD. And among those triggers we find food allergies and food intolerances. We find food additives. There's more and more studies showing that can trigger symptoms or exacerbate symptoms of ADHD. Other things that can happen is if you have imbalanced gut flora, it produces a lot of toxins that can affect the brain. There's studies showing that if you have imbalance in the immune system, it can trigger the symptoms of ADHD. Another very important trigger is lack of activity. Kids now they play in front of their computer, they play video games, they don't go out and move their big postural muscles that are a main source of stimulation to the brain. So if we don't stimulate the brain in a positive way, that can also participate to developing ADHD. And as I said, this is just an overview. In the future we'll have a series on each specific risk factors and triggers. So stay tuned, and I shall see you soon. To get 20 more videos like this and 2 great free bonuses, visit untitled.solution.com/free.